AMH, or anti-Müllerian hormone, is a key marker in fertility testing that often causes confusion and anxiety. Let's break down what it really means. Anti-Müllerian hormone is a protein produced by small, developing follicles in your ovaries. These follicles contain your eggs, and AMH levels can give doctors information about your ovarian reserve, the number of eggs remaining in your ovaries. Now, I want to break this down into two scenarios because AMH means different things depending on your situation. First, let's talk about what AMH means if you don't have fertility problems. If you're in this group, here's what you need to know. Studies have shown AMH levels don't correlate with time to pregnancy or future fertility potential in individuals without fertility problems. A 2017 study published in JAMA found that women aged 30 to 44 years old without infertility, low AMH levels were not associated with reduced fertility. And a 2023 study published in Fertility and Sterility again found that women 30 to 44 years old without infertility, low AMH levels were not associated with reduced fertility or reduced fecundability, which is the likelihood of getting pregnant in a menstrual cycle. And if you think about what AMH is measuring, it actually makes sense. In your ovary, you have follicles. Inside a follicle is an egg. The follicle undergoes a maturation and development process that results in the ovulation of an egg. AMH is produced by follicles in the early stages of development. If you are premenopausal at any time, you have multiple follicles that are in the early stages of development. And every month, one of those follicles is recruited, undergoes further development that results in ovulation. If I have 10 follicles in the early development stages and you have 20, your AMH will be higher than mine. But guess what? We're both ovulating an egg. Because there isn't a relationship between AMH and your ability to get pregnant naturally, ACOG, the American College of Obstetricians and Gynecologists, does not recommend routine AMH testing for women without fertility concerns who are trying to predict their reproductive potential. Some REI doctors disagree with ACOG's stance on AMH testing for women without infertility. They argue that as long as patients are appropriately counseled about the meaning of the results, it should be offered as it may impact their choices when it comes to planning their family. People who experience infertility and are told they have low AMH often say they wish they had known earlier. If someone is at elevated risk of needing IVF due to other medical conditions, a personal history of cancer, or a partner with medical issues associated with infertility, an AMH level can provide useful information to inform the timing or likelihood of success for assisted reproduction. In my experience, many physicians do not counsel patients about what AMH means until after the results come back. My concern with this approach is twofold. First, results are often released to patients before they receive a call from their provider, which can cause a lot of undue stress. Patients look up these results, see it discussed online as a marker of fertility, and become distressed, internalizing the belief that there is something wrong. And second, when the meaning of AMH is not discussed prior to the result coming back, the patient is not given the opportunity to decide if and how they would use the result. This is a lab that can cause a great deal of anxiety. And I believe if the lab is being ordered, the patient, you, should have a clear idea of how the result would change your decision making. Now, if you have been diagnosed with infertility or considering IVF or egg freezing for any reason, AMH becomes much more meaningful. It helps doctors predict how you might respond to fertility medications. With lower AMH, telling your doctor it might be difficult to retrieve enough eggs for IVF or egg freezing. Here are some things to remember. AMH is just one piece of the fertility puzzle. For women without fertility problems, it's not predictive of your fertility or ability to get pregnant. And for women pursuing fertility treatment, it can be a useful planning tool. The most important thing is to discuss your individual circumstances and family building goals with a qualified healthcare provider who can help interpret your AMH results in the proper context of your complete fertility picture. And remember, you are more than a number.